I'm from Mississippi.
What a wonderful view. Seattle is living up to its reputation today, buddy. You know what that means whenever you see the tops of buildings from a window. For me, anyway, it always means I'm at the hospital. I've seen a lot of those views. Stayed across a lot of rooftops. Looks like the mail will be coming home at some point today.
This video has been sped up to compress time.
She's had a seizure, so I took the time real quick to just talk about something that ordinarily expect me to talk about it. But for everyone that's on benzodiazepines, or anyone thinking about starting taking benzodiazepines, any kind, whether it be alprazolam, Ativan, diazepam, any of those benzos, want to warn you as a person who's never been addicted to benzos, but I have been around several people that were absolutely heavily addicted to benzos, abusing them, seriously abusing them. So I've seen firsthand what abuse can do, but at the same time, just regular usage, regular dosage is still such a dangerous drug that I don't see the point of anyone being prescribed it. All right, I really think they should take it off the market because
Jason had a bilateral embolism. Poor little fella's been out of breath ever since.
After so many years of taking it as prescribed, even it rearranges you chemically, your brain, and not in a good way. You had anxiety before, panic at whatever was going on with you. Benzodiazepine, what it does is Xanax and things like that. What it does is it removes your inhibitions. You could give a shit less about anything, and in some cases, anybody. So that means people's children aren't being taken care of. They're not. Women's nurturing skills are out the window with that. And I've noticed that a lot of people that are on Xanax, and after taking them for a while, they steal. Of course, that's people that's taking them, abusing them, and maybe taking twice the recommended dosage, right, or prescribed dosage. It's strange what that drug does to people as far as the theft. I was with a girl for a while, and she was so strung out on those things. She was taking 5 bars at a time. We couldn't even take her into a gas station or Rite Aid. I've got money in my pocket. I'm buying stuff for her too, right? I look over there and she's shoving shit in her purse, and I'm like, Amy, I got money. Take the shit out of your purse. Don't. She's like, save the money. Don't spend the money. Save the money. You can get me some more Xanax.
What? No, man, I ain't doing that. Huh?
You know, it's really sad. If you don't know this guy that I'm about to talk about, you should check him out. His name is Jordan B. Peterson, Dr. Jordan Peterson. He is a clinical psychologist that has been a professor for years now. He became famous for not allowing world to bully him into pronouns and shit that, this is a man who's gone through a lot of clinical scientific studies, biological, physiological, anatomy, and you're going to tell this man that, shit about gender and talk to him and tell him what there's, okay, so he's had so much backlash from this fame that he acquired from college kids. They went to war over the shit on campus. There's a video on YouTube. But anyway, Jordan Peterson, some years go by, all the press, he became famous, overnight, and the pressure, all sorts of things were going on. And he went from being a well-respected scholar, and he is a genius. I'm telling you right now, this man is a absolute flipping genius. If he could run for president, everybody should go behind him, because if you have a problem in this world, that man right there, if you're listening to him, he's going to work it out for you right in front of you, okay? And he'll give you history, background. He'll bring you all the way up to date with where you're sitting, why things are the way they are in your life, as far as your environmental stressors, all the way to your internal triggers. So the guy he's that good. For him to get depressed and to have to go on benzos, this world has got something fucking wrong with it. And so when he stopped taking them, he wasn't on them long. When he stopped taking them, he sent a public apology to all of his patients that he's ever written benzodiazepines to, and he vowed to never write benzo as a prescription again to any of his patients. So it's just incredible that a man, he's got this kind of mental capacity. He's got so much wisdom, and people don't listen to him today. Everybody thinks that they're such a, everybody thinks they're brilliant because they have a smartphone in their pocket. They think they too are just as smart. We are stupid. We don't even know how to listen to each other anymore. Okay, you got a man that's telling you that you are going to chemically break down your brains if you take this drug. You're never going to be the same. It's risk of suicide. It is the cause of a lot of patients' suicide because they can't get off the drug after they've been prescribed it. It being mixed with other drugs like opiates, deadly. You stop breathing, goner. Fentanyl, forget about it. You're dead. Xanax and fentanyl, you're dead. It's not if, it's when. Methadone and Xanax, same deal. It's not if, it's when. So, and people don't realize that if Xanax, if anxiety, if you have a problem with anxiety today, you just wait until tomorrow, because I'm here to tell you, this world is about to stress you out. If you don't know how to deal with your stress, you don't know how to properly maintain and manage your life, you're going to be stressed out, okay? Don't ask for drugs to cure a drug problem, all right? The reason that you're having anxiety because you drink too much. You're going out 4 nights a week, drinking, getting wasted, and you're going to work. Okay, so you're holding a job down. You're not giving 100%. You're not going to get a promotion. Hell, you may get fired this year. There's up and coming people that are starving. And on top of that, there's people that are coming in here from out of the country that they're willing to work for a hell of a lot cheaper than you are. They'll take your job out from underneath you in a heartbeat. I'll let them learn how to do just a little bit of what you know. You're out of there. So you think you're stressed now, wait till you go to work and they give you your pink slips. You thought now you can go drinking 7 days a week, cash out your 401k, and you're at the bar 7 days a week. Pour Xanax, mix Xanax in there, pour yourself a drink 7 days a week. You're fucked. You're never going to come back to this world. How do I know? Well, because I'm a career idiot. I'm a career addict, and but I'm also a career student of addiction. I'm a student of the psychology of addiction. I went to school. I didn't care about a degree. I've got 2 degrees. I never picked up either one of them. The first one, I was going to be a nurse. But really, I was going to learn how to be a better chemist, so I could, I wanted to be able to synergize my drugs better. I didn't trust the market, the black market. I didn't trust the black market. But, pharmaceuticals, I loved everything about them. Anyway, save yourself a lot of time, save yourself a lot of headache, save yourself a lot of embarrassment, humiliation, save yourself save yourself the time that you're going to miss out on with your kids. All these things that when I got sober for the first time in my adult life in 2014, my biggest regret was that I had never done it before. I hadn't done it sooner. And I mean, it hit me like a brick. I enjoyed my life. I was blown away. I was like, why in the hell have I done this already? What was I running from? And never again has it been so hard. I've relapsed. Of course, you're going to. Sure, I've heard all the stories. There's people that, hey, I walked in the house one day and I poured my pills out and I poured my cocaine out and I poured my booze out and I said never again, and I haven't touched it since. Okay, well, good for that guy. All right, but you know how rare that guy is? Super fucking rare. So rare that I think he's a goddamn liar. But let's say that that is true. Don't hold that guy. Don't let that guy pressure you into committing yourself to something like that. You've got to be honest. That's what this is all about. I'm telling you now. You have to be honest about this stuff. The honesty and the truth, the walk with it through this is entirely what it's about. You have to be forward with yourself. You have to be in your face. You have to admit things to people that didn't ask you if you did this or that. You have to be bold. You have to talk about it whenever someone's talking about something else sometimes, just so that you can hear yourself say it, and hear what it sounds like, and it to be true. So you're taking your power back, and it's a phenomenal feeling that if you're an addict and you're in your addiction and you're in the throes right now, you'll understand exactly what I mean by that, because it's very difficult to get out of this dark place. We'll roll off of one drug and go to something that's less troublesome. Okay, the drug itself is just as addictive, but it doesn't bring the synergenic effects that cause lethargy or certain things that are causing you problems at work and home or whatever else. So you take something else that counter affects that, or you stop taking your drug of choice, but you take something else anyway, put in its place. Point I'm trying to make is that cycle remains untreated. It remains the same. So am I an addict today? No, I'm not an addict today. Today I am not sitting here. I know what an addiction is. When I can't think of nothing else, I'm looking around. Everything is about this drug. Everything I do, I walk, I talk, I breathe it. I am not addicted to anything today. I don't have to do any of it. I could go wherever I want in this world. The world could shut down today, and they send out a message on everybody's phones 5 minutes before the phones start working, and it says there will be no more chemical precursors. There will be no more chemical ingredients sent over from China for America to make their drugs. All pharmacology will cease in 24 hours. What do you think the doctors are going to answer their phone? Fuck no, it's over with. You get something like that, when they tell you that, you're at war. All right, and they're bleeding your country dry. They're making you bleed. That would be the major bomb. They don't need a nuclear bomb. They've got pharmacology, alchemy. They don't need fission, nuclear fission, atom bombs. They don't need any of that. This pharmacology is their weapon, and it's been weaponized to the point now that we have a whole country that all you have to do is flip the switch, and that conveyor belt stops rolling out pills. It's over with. This country is done. Just out of the psychological warfare of that, because there's so many of these drugs that act as a placebo effect, even though the patient feels like that they're really getting something out of it. Maybe they are, maybe they aren't. But my point is that you are not going to give yourself the chance to find out, because you're automatically going to feel desperate, and you're going to feel cooked. You're going to feel done. You're going to feel hopeless, and you're defeated already. And so people are going to be going after each other. I'm talking about grannies. You're going to have grannies 70 years old who's going to be breaking into her neighbor's house, Jack, to try to see if she's got any of her methadone over there or whatever. So if you're taking any kind of drugs that are addicting, if you're the least bit hooked on these things, man, with this stuff that's going on in this world today, do yourself a life-saving favor so that you don't suffer on your knees in the street and die. Take the time out today to go get yourself straight. Get cleaned up, get sober. You owe it to yourself, and I'm telling you, from a person who's been there, it's the best feeling in the world to be sober. I lived 22 years of my adult life at a party, ongoing, man. So I absolutely know what you go through. But I'm telling you, man, it's doable. If I can do it, hey, I had accepted that I was going to die with it. You know how terrible that is? I had literally accepted that there was nothing I could do, and that maybe I could just maintain it and live out a decent life, but my liver was going to fall apart and I was going to die. And hopefully I didn't die before my grandfather had. My grandfather died at 56, and my main goal was just don't die before 56. 6 years from now, hopefully I make it. But that's a hell of a damn goal, you know? All right, people. Stay well. Have a great attitude about things. You can do this shit, man. Look, I'm telling you right now, if I can do it, everybody can. We're all chosen. You just have to accept the fact that you got what it takes and bring it on. Peace out.
I'm from Mississippi. Yeah, we pussy P on them, but I be stand for pimpin'.